The gentleman from Texas is recognized for 2 minutes.
Thank you, Ranking Member Levin. Thank you for yielding to me. You know, we speak a lot in this body about the freedoms that as Americans we have been endowed by our forefathers and that are enshrined in the Constitution, whether it's the freedom of speech, freedom of religion, our Second Amendment freedoms. But I think we all understand and know, and unfortunately too many Americans know firsthand, that when you're sick and lying in a hospital bed, or where you're at home and you have a child that you can't afford to take to the doctor, that those freedoms mean very little. How is someone who couldn't get health insurance, whose life is spiraling downward, who can't afford to make their car or mortgage payment, how much are those freedoms worth when their life is spiraling downward because they can't afford health care anymore? The fact is, the Affordable Care Act, one of the greatest things that it's done, is allowed more Americans to be able to enjoy the freedoms that all of us here in Congress fight so hard to protect for the American people. A few of the troubling things about this bill is that 1 million people, up to 1 million people, would lose their health care coverage if this piece of legislation was enacted. As Congressman Levin mentioned, it would cost $74 billion to the American people, adding to our debt and our deficit. What's also interesting is that just about every bill that is allowed to pass through the House of Representatives in this day requires a pay-for. The Republican majority does not allow a piece of legislation to be passed unless it is paid for by cutting something else. What's different about this piece of legislation is that there's no question that it would cost $74 billion, and yet there is absolutely no pay-for in this bill. I would also note, and as was mentioned, that this would cost American business some money. Well, a few things. First, even many American businesses don't define the work week as 40 hours. They define it as 32 hours or sometimes lower, sometimes 30. Can I get one more minute?
2 minutes to the gentleman.
The gentleman's recognized for an additional 2 minutes.
So this is inconsistent even with how millions of American businesses define full-time employment. And I would also point out this. We know as our economy has started to rebound from the worst recession that we've had since the Great Depression, that many American businesses are doing well, that Wall Street is hitting all-time highs, that the stock market has soared, and that's a good thing for America. And we certainly don't begrudge any company that or any business that. But small businesses are already exempted from the ACA requirements. So this is about more sizable companies. So in an economy where business is doing well, why should we say to all of these workers, people who are going to work every day, who have incredible work ethic, who are powering our economy, that they don't deserve health insurance? You know, I was in San Antonio, and I know in many cities we had long lines on the last day on Monday to enroll in the Affordable Care Act, and people's faces lit up because for the first time in many of their lives, they were going to be able to afford health care coverage. And many of them had their kids with them. There were teenagers there. There were senior citizens there. This is a milestone in people's lives.